Yeah. Recording is on now.
Okay, thank you very much, and good morning, everyone. On behalf of the Social Science Research Group of the NCRC, would like to welcome you to the second annual webinar where we interrogate the current situation that is plaguing the whole world. Today we can talk about not just the COVID-19 pandemic, but we have the Delta variant, and then latest is the OMICRon. Yet the world is no longer the same. As we did in the first presentation last year, we will be having a close look and also advocating in some cases way forward for the global community. We have been hosted by the Center of Excellence, in Migration and Global Studies. And our chief host is Dr. Gloria Neto. We will be with us for at least a minute or two. The ground rule is that each of the panelists will speak for 10 minutes. And then at the end of the day, we will have the discussants to give us their views. And then we open up for general comments and questions. And then we wrap it up. Again, we'll follow that process. Social Science Working Group, the NCRC, and he also is also the host as well as the co-moderator because of my present location. Again, we thank you for finding the time to join us. I believe, as all the members of the Social Science Research Group, that you will not have joined in vain, whatever your location and situation at this moment. But the watchword is that we all must be safe and take precautions and follow the protocol. So the title of our discussion today is Omicron at Christmas, Issues in Festive Behavior during COVID-19 pandemic. Again, is an indication that COVID-19, as some of the scientists, experts have said, is not going anytime soon. Neither can we be talking about post-pandemic as some outlets are trying to, because it has become what they call syndemic. So again, today the expert will talk, we will listen, we will learn, and then we ask more questions. Thank you for coming again. So at this point, I will yield the virtual floor to Professor Gloria Neto, our host, for 1 minute. And then thereafter, the chairman of the group, Professor Jegede, will speak to us for another 1 minute. And then the first panelist will please speak for 10 minutes. And if you need to share, please do not talk about, I want to share, just chat with Professor Jegede, who is the co-host for this session, and he will share your slide. Again, if you are joining us, kindly please mute yourself if you are not speaking. Mute yourself. That is part of the rule, because if you do not, you are lucky I'm not given any right to do anything. I'll just put you in the other room so that you can do your own thing and allow us peace. Thank you very much. Professor Gloria Neto, you have the floor, man.
Yeah, good morning. I'm Gloria Neto. Thank you so much, Professor Tijani, for making me part of this, because I heard about this group and I wanted to be part of it. I was told that it is full and no space again. So I'm not part of it, but however, since we are now hosting, at least I'm witnessing what is happening. And I'm grateful for that. And I welcome everybody. I hope we all have a very fruitful session, because this is just a timely topic for the season, just timely. And I'm sure many people here will be very much enlightened after today's discussion. So once again, I welcome you all. I say thank you for making me part of you here today. Thank you so much.
Thank you, Professor Jegede, please. The Chair, Social Science Research Working Group of NCRC. Professor Jegede, can you unmute yourself, please?
Good morning, everyone. I'm glad to welcome you to this webinar. It is the second this year, and this is targeting the current variant of the pandemic and the season of the year. Hope that at the end of this discussion, we will be able to make important contribution to the direction as to which the country will be able to tackle this menace. And I thank you all for joining us. Thank you very much.
Thank you. So who is the first panelist that will present to us, please? You have the floor, the virtual floor. You can speak to your paper if you don't have a PowerPoint, and then you have 10 minutes. Professor Jegede, who is going first? Or who would like to go first?
Professor Bono.
We cannot hear you, Professor Bono.
Can you hear me?
Yes, we can now.
Yeah, I'm just saying that it's okay for me to go first, but note that I was listed second.
Oh.
Thank you for accepting position number 1. You are no longer chief of staff, you are the head of state now. That's good.
You go ahead. The host has disabled participants screen sharing, and they have said we shouldn't say we are going to share screen. What do we do now?
I said you should just
go ahead and share.
That you should chat with Professor Jegede. But Professor Jegede, please, can you give him or the Center of Excellence give Professor Bono, all the panelists, once we mention their name, you make them co-host, please. I don't have the functionality, but Professor Jegede can make.
You are a co-host, sir. You are a co-host. Yeah. Looks like somebody has to leave for him to be.
No, the host can make people co-host, can make us.
I can't see the space for more. It's like it's exhausted. So let me.
Prof, in the time being, can you speak to your paper, please?
Sure. Although there are some visuals that.
Okay, that you like to share.
This paper is about only slightly from the presentation I had. The first webinar we had on this topic last year. We were indeed discussing COVID-19 transmission at Christmas. Because Christmas was a peculiar religious ceremony, or either because of its doctrine or its apologetics or anything, but simply because
you can share your screen now, Prof. You are now a co-host.
Basically, the departure is only very slight at face value, but it's actually enormous when you consider that certain characteristics of the Omicron variant marks the commencement of the fourth wave of the pandemic in Nigeria. It's similar to the human characteristics of the erstwhile asymptomatic population globally, in Nigeria in particular. That is a young population. And when you look at forced migration in the context of the worst economic indicators that Nigeria has experienced in decades, the expectation is that there will be accelerated migration among the youth. At this time, in search of newer economic opportunities. Christmas presents an excellent opportunity for people to meet who would otherwise not meet easily. So observers expect that young persons are likely to accelerate migration at exactly that time that Nigeria has identified on the record 3 Omicron cases. And when we look at the attributes of that mutant virus, it's worrisome at a time like this. So that's the context of this presentation. So just to reiterate, the webinar does not interrogate the values, beliefs, and all of that of Christmas or any religion. Just used in this webinar as an accidental case study to contextualize seasonal risk factors in festive behaviors and sensitize Nigerians to the risk inherent in festive celebrations, especially those which bring together a high number of persons in super spread events where physical proximity is the norm rather than the exception. So we hope to urgently discuss the ramifications of traveling at this time, because that's the core variable, apart from other in situ risks, such as family meetings, weddings. All these take place at any other time in the year, true. But at Christmas, there's again that ready-made opportunity for people to meet just once instead of repeatedly for a variety of events. So we seek to develop appropriate health messages to confront this. And speaking ahead of time, from the nature of the discussion, it seems to me we should contemplate another kind of lockdown, but this time not to the granular level of the household. The state was not prepared for a measure it took last year. But this time, at least we can confine individuals to the communities where they will be spending a particular day. Take, if it were today, if you slept in a community today, then you will remain in that community until at some point after January 1st to be predetermined. So movement within the community will be permissible. This would aid the rapid tracking of the transmission of the Omicron, and at the same time, free people from the depression, the depressive states, and all manner of unintended social and clinical consequences that the 2020 lockdown imposed on Nigeria. Intra-community, but no interstate, no inter-community travels. In Nigeria, where authorities by yesterday recorded 215,164 confirmed cases and 29,880 deaths, the forthcoming Christmas holidays are a corollary of America's Thanksgiving and a recipe for the rapid spread of the coronavirus across the 774 local government areas and 36 states of the Federation and the Federal Capital Territory, especially given current information about OMICRON variant. This year, Christmas will be occurring at a time when Nigerians are still experiencing some of the worst economic indicators in decades and are more vulnerable to forced migration, which could intensify the established patterns of festivity-induced southwards movements at Christmas. That's the annual pattern for decades. Young people are expected to form the bulk of these movements as they move about in search of newer economic opportunities. From the social science perspective, Christmas is viewed as an essential human activity, a rite of intensification, which is defined as a ritualized means by which group solidarity is reaffirmed and reinforced. Can't take that away from people. It carries the same associational risk though, as does Thanksgiving and so on, Ramadan, and any religious or non-religious activity that brings large crowds together and constitutes that activity into a super spreader event. This is pertinently so with the COVID-19 pandemic, where human proximity is critical to the transmission of the virus. So there's a dialectic playing out here, which you find the Conquest things fall apart. Well, Conquest categorically points out that in the midst of happiness, there is danger. At that time when the mood for festivity is so high, it's as if danger lurks in the shadows. We don't want to make people lose that spirit of peace and joy and giving that historically came with Christmas. They can retain that, they should. But we do want to point out that the reality is that in all the hugging and kissing and moving about, we're shifting about a risk. People should be able to rejoice and be contemplative at the same time. Now, I've created 4 elements in what I call an OMICRON migration, because it's linked to the third, or is linked to the third of the vital events that demographers discuss. The other 2 being births and deaths, in this case, migration. So you would have to look at origins and destination. So there are risks at origin, risks, that's pre-travel risks, risks during travel, risks at destination, and then risks during return travel. There's a missing element there, and then risks at origin. What do we mean by risks at origin, which are the pre-travel risks at origin? The pre-travel risks at origin deal with the shopping, the tremendous concentration of human bodies physically in a very limited space, like in Dugbe Market in Ibadan, Adamasingba. Even in the more sophisticated supermarkets, you actually see huge, almost uncontrollable crowds at a time like this. So the risks, the pre-travel risks at origin of migration deal with concentrations of that kind. How do people go and buy chicken and oil and groundnut and onions in a typical Nigerian market, and a whole lot of meat and stock up, especially as Christmas approaches, there's a rush last minute. How do we make that kind of behavior respect the risk that exists at that time? It's a very consequential question to ask. And then the risk during travel, especially depending on how one travels. Will the airlines create physical distance on board, except one traveled in one's own car? That's likely to be reduced because of the state of insecurity, interstate insecurity. Okay, so you are left with buses, long distance buses, all the way from the north to the south. People crammed in. So there are risks during travel. There are risks at destination. Those ones are sedentary risks, dealing with family meetings, church bazaars, youth meetings, crusades, and maybe just friends getting together, and then the weddings, and then the funerals, the naming ceremonies. At destination parties, this bring people together. And then the risks during travel after Christmas itself replicate the same thing that you had before the migrants or travelers got to their destination. And then at origin, all kinds of visitings take place, residual visits, people who had brought gifts for others come back. The concentration of persons is not that large, but the risks are still there because people have moved all over the place and have come together and they are very close. There's the thing between about where there is propinquity, there is expected proximity. Proximity follows propinquity. Once you are close to somebody, it's almost as if for that reason, you can't catch something from that person. That's why back in the day, you find Africans, a brother cuts his finger while trying to cut his nail and is bleeding. And in a show of fraternal, propinquity, one of them will be trying to suck that blood away. In Africa, things like that happen, but they should not happen now. So when people return to base, they probably brought money or they brought a cell phone or something with them for somebody, and that person comes. These are people coming from different environments into close physical spaces. And these are the explanations that have been guiding the schema, guiding my thoughts here about explanation, prediction, and control. If the explanation of the phenomenon is secure, then the predictions can follow and the control measures will make sense. And the chief control measure is a community-based lockdown. So to conclude, Christmas is an event which, in the regime of the COVID-19 pandemic, could promote super spreader events in the same way of festivities that increase unprotected human contact could do. This Christmas is, in this sense, Achibe-esque. In the midst of the celebrations, there is a risk of a surge in transmission and a surge upon a surge in the return migratory flows because you remix not just patterns, but risks. It's remixed risks. If transportation and movement are not regulated, there could be simultaneous super spreader events in all motorparks and airports across the country. Internal migration will play a huge role in driving the spread of the virus this December. Exhalation will have consequences. It is important to balance the natural need to be close to loved ones with the need for all, including those loved ones, to stay safe. I recommend restricted movement to the community in which a person finds themselves at a given date. One couldn't travel into or out of that community within that time period, but intra-community movement will be allowed. Mr. Chairman, thank you for this moment I've been granted to share my thoughts. Stay safe.
Thank you very much, Professor Obono, for a brilliant presentation, outstandingly informative, and has not given us in some quarters what they will call academic, too academic. It is so informative, and I have learned, like most people. We thank you for this. If you have questions or comments, kindly please wait until all panelists present, and then we can, and then the discussant also make their interventions. At this point, I would like to call on the next panelist who will speak for 10 minutes. I was enjoying, and I believe all of you were enjoying Professor Obono's brilliant, informative, unambiguous presentation. That is why I just allow it to go on and go on beyond the 10 minutes. Thank you, sir. Always very, very succinct and lucid presentation. The next presenter is our senior colleague, Professor Asuzu. Baba will be speaking to us. The title of his presentation is The Public Health Fundamentals in Flu Pandemic Control as Nigeria prepares for a possible OMICRON wave of COVID-19. You have 10 minutes, sir, to make your presentation. And at this point, Professor Jegede, kindly take over moderation. As I've requested, I will need to be in the other event, at least sign in as a keynote at the other event starting in less than 7 minutes. Thank you very much.
Okay, I hope everybody is hearing me.
Yes, loud and clear, sir.
And seeing that I'm in a car in transit.
Yes.
Thank you, everybody, for what we have had. I'm supposed to talk on fundamentals, both for the audience in general and for us as health professionals. Next slide, please. Can I have the next slide, please?
Who is controlling the slide? Okay, thank you.
All right. That's the way I'm going to take it. Pandemics, because we are talking to the public. If most of us on the panel are professionals, these are what I think we should do to the grassroots, because we have that responsibility. That pandemics are epidemics of infections that are all over the world. So, and the effects or the enormity varies from country to country. So it's not enough to be thinking about yourself. You should think about yourself, about other people, about your state, how people are behaving there, and whether you can intervene as a public health or a public officer, how your country is doing it internationally, and contribute to moving people around. I need to talk about the present pandemics and some mistakes that we have seen or had, which we must be stimulus to grow the right muscles professionally, intellectually, and academically, and socially to get the issues where they're going to go. And the history of pandemics, especially of flu pandemics, how they have occurred, what the repeated episodes are about, or the waves, and then look at the fundamental issues. Next slide, please. Well, pandemics are worldwide epidemics, and for flu, they occur in waves. And this is because this is a flu illnesses that are easily transmitted airborne by people who are close, from wet coughing or breathing or touching your face, eye, mouth, and nose, and transmitting the infection. So periods of time when we relate with people who are close to us, where this hygiene may be forgotten because of the emotion involved in it, we need to warn ourselves that we must be careful to follow the rules, even in the house. Professor Bono talked about the various sins. When he said traveling, if you are in your car alone, you may have a driver, you may have other people who are in the car who are not immediately in your family. But even if they are, it's good to follow those protocols as much as possible. Nigeria is an important country globally. And whether we know it or not, the whole world is expecting Nigeria to perform in a leading manner. Therefore, we need to behave like that. Next slide, please. Okay, so as we should make people to know that the current flu, COVID-19, originated in China, in Wuhan, but in a rapid way, it spread throughout the whole world, and Nigeria got its first case on the 28th of February last year. And we did not give a national response immediately, regulating countries of travel and testing people, or limiting travel, or contact tracing of people who come from abroad so we can limit the disease. Well, over time, NCDC has created this, our research consortium. And the NCDC itself is doing such an excellent job that is being met now. And people are having pre-travel tests, not only in the interest of the countries they are going to or the person traveling, but in the interest of the country, and doing tests when people come back. And in many places, initially, when the funds were being disbursed by the coalition formed to respond to this financially, it was noted that the politicians came into it in many states. And once people observe that an issue has become politicized, their response to it is not good enough. This is very important. Politicization of any disease control program will make the public generally mistrust government. And this is not in Nigeria alone. In Canada, in Australia, people have made this point, that the way political party function goes on makes many people not to trust what government does. And the World Federation of Public Health Association did continuously addresses this at every meeting we go. Why public health professionals or public servants, including all of you professors, professional people, even if you are not in the university, must recognize the need for them to progress with information that people accept as authentic because you are, and to counteract any misgivings they have about government. They must have the facts at their hands. Yeah, I have addressed that issue. Next slide then. Next slide, please. 3 waves, we have had 3 waves already of the pandemic, which we will look at shortly. And in history, only one flu pandemic had a 4th wave. But the way this disease is going, we may have a 4th wave, we haven't have a 5th wave. The containment of the disease is based on people's behavior. If people respond to established public health ways of preventing disease, you can stop the waves, you can end a pandemic very quickly. This is why it's important to visit that issue. When the Delta variant of this pandemic originated again in China in the late months of 2020, it did not get here until about July this year that NCDC first got the first case and notified everybody. But we know that Delta variant was more mortal, caused more deaths than the original COVID-19. Now we have the Omicron that apparently originated in South Africa, but it spread, around many countries. The mutation it has had is the highest that has been noted anywhere. That's why people are frightened with it, even though the WHO Director General yesterday's statement says that it would appear that the capacity of the Omicron is to be transmitted easily, but the mortality doesn't seem to be as terrible as Delta variant. But you never know, the experience is short in many countries. So we must, if we had capacity for more easy transmission, then we must worry about it. Next slide, please. This slide shows the waves that we've had in 2000, and the second wave beginning in the late month, November of last year, and faded, and the new wave that has, is ebbing out, but it's ebbed out. And the first case of Delta variant was identified in Nigeria in July this year. But we know many top-class people have died from it, including University of Ibadan and Lagos, in Abuja. So if this Omicron variety has a chance of greater transmission, then we must be very careful about it. This slide shows us the waves, and trying to indicate that we have not started a fourth wave. And that's the reason we must be very cautious to address the issues of the full public health response. Next slide. Okay, so even though we have vaccine and the vaccine is being given, we need to take on the fundamentals. Stay at home, don't go anywhere, do your work at home. One of the good effects of COVID-19 is that almost all universities, you can give your lecture from your house. So, and many other things, and limit contact with students and other staff. I called a next door neighbor yesterday who works with one of the oil companies. He's doing offshore. So I asked him, are you offshore? And so I said, oh, I'm inshore, and that will last till July next year. I do all my work from house. So many other institutions have done that. So stay at home and work from home is happening and is good. Number two, if you go out of your house, maintain a social distance of at least 3 feet, but up to 6 feet. It doesn't matter if people around you think you are stupid. Tell them that you are, but you are preventing disease, both of yourself and of them. Wash your hands for at least 20 seconds with soap and running water. And maintain face, which means mouth, nose, and eye hygiene. Don't touch them. And luckily, many centers are producing high alcohol content, alcohol-based hand sanitizers. Everybody should have a small bottle in their pocket or in their bags or whatever it is. So if they touch rails of doors or rails, or rails or climbing staircase or whatever, they should, where there's no water, they should clean their hands. As much as that. I think I have over 15 bottles of alcohol hand sanitizer in my office, in all my cars, in my bag, traveling bag, everywhere. So we can give to people who don't have. It is our duty to encourage people to do these things. We must wear face masks. Again, we should have plenty. Yesterday, I went to the hospital to do something. And the boy I took to help me, I was driving. When I got to the hospital, I said, where is your face mask? He said, you forgot it. I pulled out one from my bag and give him. We must carry that. and show that we know what we are doing. Not only us wearing, but anybody that we can influence. The more the number of people who follow these rules, the more others know it is important to do so. Next slide. Next slide. We must listen and learn all, listen and learn all the known symptoms and signs of the disease, so that if we have any, we should avail of public lab examination. Incidentally, the federal government has given money to 52 teaching hospitals and federal medical centers. And many states have developed others, and it's online. So people can register for an investigation and go for it whenever they have any symptoms. If you catch people with infection with low carriage of virus, home isolation, following established norms, eating well and resting well will help you. Many hospital staff that caught the disease and were diagnosed early have all survived it. I can't count now how many doctors I know who are involved in COVID-19 who had got the infection, but not one of them died. All of you may remember at the time they said the provost and deputy provost and CMD of UCH got it. They all survived it because they tested early. So we should do that. We must learn about the importance of vaccines and take the vaccines according to our conviction. If you, for reason of the way the vaccines are produced, you say you wait for killed virus vaccines or attenuated vaccines, well, the more reason why you should follow all these rules. But please take the vaccine if these are not important ethical or medical reasonings that you have. Those who have taken the vaccine should have a booster dose. For one variety is 2 months, for other varieties about 6 months. The flu immunity, even developed naturally, doesn't last that long. That's one of the limitations of flus. That's why they're able to come in several waves, because the return you develop after a wave doesn't last you more than those 2 months. So these are the fundamentals, and we must do it ourselves so that others will see. Vaccinated or not vaccinated, these fundamental rules are important. And the onus is on us as professional or public servants to do it and encourage others to do it. I think that's the fundamentals to review it, and I thank you for your audience. God bless you. Over.
Thank you, Professor Asusu, for the wonderful presentation. And I'm sure that presentation is very enlightening and has directed attention to the important public health guidelines that we should follow. And now I'm going to be the next speaker on this program. My name is Ayodele Jegede. Fortunately, I don't have a PowerPoint slide to share, but my topic is social norm. I mean, social innovation in the control of OMICRON variant of the COVID-19 pandemic. I will start by saying that the structure of my presentation does the introduction, the bridge that connects the population to the disease, and then the solution to the problem. I want to start by drawing our attention to the importance of Christmas, as Professor Bruno has reminded us during his presentation, but also to add that it's a period of, where people demonstrate their love for the loved ones, thereby fulfilling the mind of God. Say about loving your neighbor as yourself, which is the second law. And we also, have this practice in other religious celebration, during which people try to relate and share resources with their fellow neighbors, as well as relatives. The period where people do meetings, a period of renewal of relationship and interactions. But one thing that I want to say is that as much as this period is a period of joy, just like Professor Bono mentioned, it's also important for us to recognize the danger in the in happiness, because not everything that looks like a good, that glitters like a good, that is gold. But at times there's always a time that we need to take a break, even within the context of happiness, to ask ourselves some questions about what are likely issues to arise from this joy. It's natural. It's about the way the world itself is made. So another point I want to make is that when you look at the nature of the COVID-19 virus itself, is something that thrive within, with relationship, with human behavior. That means leading us to understand that it's something that is transmitted through human activity and behavior, especially relationship. And therefore, we can simply say that the bridge that connects the population, the general population, to the risk population is, is critical in controlling this particular disease. Unless the bridge is broken, the mode of transmission will continue to increase. I'm happy that when Professor Bono was making his presentation, he tried to classify this bridge into 4 areas. And unless we have a critical look into those areas of life that connect people to the risk, population at risk, we may not be able to get out of the doldrum. And so for this reason, I'm trying to look at the response that's supposed to lead to the break in this bridge from 3 and after maybe even 4 perspective, from individual, from the community, and as well from the institution, and also the household level. From the individual, the model I'm recommending is what we have also been trying to adopt even here in the University of Ibadan, is because our health is our personal responsibility. To be in good health depends on the individual, as well as primarily on the individual, and also secondarily by the environment, even though some might say that primarily by the environment, but the individual has a more primary responsibility to ensure that they stay healthy. So the personal responsibility is quite important, and this can also be further explained by the reinforce the God's mind in terms of love your neighbor as yourself, is to take a personal responsibility. It is important that it may also be a kind of reflection in terms of how you also care for your neighbor, because if all of us decide to take responsibility in terms of fulfilling the control measures, like face mask, hygiene, and other non-pharmaceutical measures that have been recommended for control of this disease. Practically, we are not only protecting ourselves, we are also protecting our neighbors. At the household level, it is important for people to at the household level to take responsibility in terms of the provisions and the making our members to realize that they are not alone in terms of what concerns their health, and once we take that responsibility at the household level, that will determine in terms of what we taking for prevention, not only in terms of the non-pharmaceutical, but also in terms of what we eat. This is a time where people need to fortify their the meals they eat at home to supplement the food with things that can make enhance the immunity of the body. Realizing that the level of poverty now, and we do not need to wait till when we will need to go and spend a lot of money on some of these things that we can actually do provide for ourselves at home. It's supposed to be a period of reflections and to by people to say, well, what can I do differently in the household to mitigate the effect of this challenge? Let me share examples with you. It was during the COVID period that I realized that I can do some things at home to enhance my standard of living. Some of the things that we try to spend money on before the COVID, we don't spend money on it now because I raised my own chicken, I raised my own turkey, I raised my own, I plant my own vegetable in a small garden and things like that. These are little things that we can do to enhance our well-being, even in the context of this pandemic, and make us to spend less on hospital services, because everything is depending on our ability to look after ourselves. And at the community level, the community is supposed to take a responsibility by ensuring that the individual members in the community comply with the recommended preventive measures. Professor Bono mentioned some of the things as talk about the individual staying in the community where he finds himself maybe for the first time until after some time. This can only be ensured if the community takes responsibility to ensure that every new entrance into the community obey this rule. So in that price, the community will be reinforcing and complementing government efforts to control this measure. I want to say specifically that at social gathering, the social distancing may create some problem, because if you're socially distanced from ourselves, we may have a problem. That means that we will not be relating to one another. But we have argued in our group that physical distancing is will be more appropriate. You look at the way people interact at a social gathering in our communities, religious places, worship places, you find out that there is no physical distancing has been forgotten completely. So the distance, even though the social distance was defined in terms of meters, this should be actually properly adhered to more critically. And lastly, the government must ensure that the protocol should be made public in such a way that the communication, risk communication, will be more adequately provided, because information is very important. Professor Azuzu talked about trust during his presentation. Trust is very important at this time, because for government, for individual members of the society, citizens to comply with government directive on a pandemic like this. The element of trust is very important. This must be enhanced so that this pandemic will be a thing of the past. We know that the kind of misgiving that attended this pandemic at the beginning. We knew about the misunderstanding or misinterpretation or different interpretations about the vaccine and things like that. In a newspaper yesterday, I read that about 1 million doses of a vaccine waste was a waste because they were not used. And the minister was talking about the donors willing to give out or use the vaccine before they get expired. So these are, the decision to use vaccine is an individual decision, and this decision may be influenced by the members of the society. So we need the individual, we need the community, we need the household to come into terms with the with this disease and make sure that the right decisions are made to counter the spread. So in a nutshell, I'm trying to say that we are all in it together, and we should all fight it fight this disease and to stand still, and that the best vaccine to it is behavior change. Once we change our behavior, all other things will fall in place, and whatever interventions that is put in place, especially like the vaccine and others, will be able to meet the needs of the society and the health standard of the individual. So thank you very much for listening. So thank you. So now it is time for discussion. Professor Okoye. Professor Okoye, Ifeoma Okoye, please. Professor Okoye. Unmute yourself, Professor Okoye. Professor Okoye, are you there?
It's not there. It's not there.
She was there earlier. Then if she's not, maybe she has an internet connection problem. She was here earlier. Then maybe we now go to question and comments from the way we are going to do it. Please indicate your by raising up your hand, and some questions can be shared on the chat. I think we have like 10, 20 minutes for this. It is question, comment time. Contribution from the audience. Any interest, any? Yeah. Anyone? Okay. Yeah, thank you. Go ahead. Maybe network. Dr. Adam.
Good morning. Yes, good morning.
Good morning.
Thank you very much, the moderators and the faculties. It was a very good input from all the faculties. They actually concentrated on the subject matter and the key points were actually noted. My question goes to all the faculties, really. You see, now that we know that the Omicron virus, that is a new variant for the COVID-19, is less lethal compared to the Delta variant. The continuous banning of flights from country to other countries is not actually what the entire country should actually focus on. Rather, they should actually focus on the non-pharmaceutical modalities of preventing the spread of the virus. At the same time, try to see that there is more awareness to people within the communities on knowing that these viruses are still with us, and let us be very, very cautious on how we interact. More awareness in our communities about getting the jabs so that people should actually get vaccinated. I think that is more important than just to be saying flights from this country, there are red lists and so on and so forth. WHO has made it categorically clear that these traveling bans should not actually be exercised. And I don't know why things like that are still going on. If Nigeria is now a banning country, I think our leadership should actually take a proactive measure to ban any other country from flying into our country too. Because unless we are surgical about these issues, I don't think we'll actually have any face in the world. The time was to be very weak in terms of formulations of stringent policies. By the time we ban all these countries from coming, and any of them that is in the country, Nigeria did not start COVID. Up to now, we have not actually have any variant that is novel from us. So why are they saying they should ban Nigeria? I think it is high time we actually ask all foreigners are in our country since December 2019 to start paying for another COVID test, and then we take their blood for variant screening so that any of them that is having this new variant or transformations from the normal, we actually pin them down, quarantine them until they actually, or even evacuate them back to their country. If we are not surgical about how we go about this thing, they will just consider Nigeria to be a dumping ground for any rubbish. So I think the panelists should respond to this very importantly. Thank you very much. Over.
Dr. Adams, bring your hand. Okay, thank you. Any other comments? Yeah. Yeah. I don't know whether it's Dr. Professor or Chief Adenipekun. Please go ahead.
Adenipekun.
Thank you, sir.
Well, I want to appreciate the organizers of this program, of this lecture. Again, I'm sorry, I actually joined a bit late, but I was able to follow the last speaker very well. I was able to get the main gist of the program.
Please introduce yourself.
Okay, I'm Professor
Adenipekun. Okay.
Professor of Radiation Oncology, University College Hospital, Ibadan.
Okay, thank you.
Yeah. So, like, well, it's this issue of COVID-19. The way things are evolving, it's obviously a problem that will be with us for many years to come. And as we've had Alpha, we've had Beta, we've had Delta, we are having Omicron. Eventually, we'll see have Omega. And I think the way countries are going about it, it's not really the main, it's not the best of approach. Especially Nigeria, we should stop being a donor-driven health services kind of nation. We have to do everything possible to ensure vaccines are produced locally. It's a disease that will be with us for a long time. I know we complain about people not trying to follow the social distancing thing, but we are humans. Keeping people away from each other to 2020, 2021, and you still think it will work. It's very unlikely that that will work. We should step up vaccination, increase education, educate the people why they need to be vaccinated. Government to work assiduously to ensure that vaccines are produced locally, because this thing will be with us for a long time to come. We should ensure that we should encourage people to use the non-pharmacological approach, and so that we still be able to have a near normal life. The way the external countries, other countries have been treating it, is as if it's a new disease. It's not a new disease. We've had experience of this disease for 2 years running, and they are treating it as if it's new. All those variants will still come. Eventually, Omega will come, whether we like it or not. But the idea is to live by it, know how to protect ourselves, and still live a near normal life. We can't shut down everything because there is COVID. Do everything possible to protect ourselves. That's the way I think it is. And those countries working against Africa, I think this is the time Africa should stand up and be united and make sure that we cannot just be pushed left, right, and center all the time. I know the poverty is there, but if we are united, we can actually fight this disease as a continent and stop being bullied by the Western world. Thank you very much for my comment. Thank you, sir. Thank you for the opportunity.
Thank you, sir. Thank you, sir. Any other comments before we respond? Okay. Professor Bono, do you want to go first? Oh, okay. Doris, please introduce yourself.
Okay. Good morning, sirs. Good morning, profs.
Yeah.
My name is Doris from Medical Sociology Department, University of Ibadan. Well, I think the ban, I see it as a control measure. I see it as an eye opener, and I don't think they are really working against Africans, because if there was no ban, if the Canadians didn't find out that there is Omicron coming from Nigerians, we wouldn't have known in the first place that we have the variant here. So I think what we should just do is, like profs have said, like doctors have said, and we have scientists that can actually produce these vaccines locally. Let us do them locally. Let us encourage our own. Use what we have and not being dependent on them. So we shouldn't see every of their reaction or their actions as working against us. Let us learn to use our own. Let us educate more people to be vaccinated. Let us encourage them. A lot of people are not even interested in wearing the masks or having physical or social distancing. They are not interested in that at all. We should tell them the need to get these things done so that we protect ourselves. And then we encourage local production of vaccines. And that will go a long way to help us. Thank you.
Yeah, thank you. Professor Asusu.
I was raising up my hand because I'm with the reception here is good as I travel.
Okay,
so
okay.
Talk. Now, to these two issues that Adam raised and Professor Adenikweku. This is not, when you politicize a thing, you lose capacity to do things professionally correct. And we must encourage scientists to be scientists and respond. If any of you listen to the conference they had on Monday and Tuesday and Wednesday at Abuja, Professor Tomori was lost his composure at his presentation. Failure in what we do as public health will
Oh, network. Does anybody, while Professor Asusu will come back, does somebody want to speak? Okay. Professor Bono, do you want to respond? Okay. Center of Excellence. Who's that Center of Excellence?
Thank you. I'm Gloria Neto.
Okay.
The Director of the Center of Excellence in Migration and Global Studies in National Open University of Nigeria. Mine is, we are all advocating for vaccines to be produced, but I have realized that the people themselves are not interested in being vaccinated. Because these days, especially recently, there has been a lot of propaganda about this vaccination. People don't even authenticate the authenticity and just post it to various groups on WhatsApp and postling the bias that already exists about this vaccination. That is one angle this group needs to work on more than even, yes, we need to work on our own vaccines, but you are producing them for some people to have them. And these people are not interested. And they have been biased more and more against them, saying that if they say something, this one said that, you know, people are gullible. So how do we handle this? This is the main problem concerning vaccines in this country. Because even the ones they brought, yes, we will say many people have received, but not many at all compared to the number of people we have in this country, about 200 million people. And so, I don't know, that is my own concern. How do we stop this propaganda? How do we get people to get convinced about being vaccinated? Then, lastly, is our own vaccines being produced. Thank you.
Okay. Yeah, thank you. Thank you, Dr. Aneto. Yeah, I think we can respond now to the comments. Professor Bono, do you want to go first? Professor Bono. Professor Bono. Okay.
He's muted. Professor Bono is muted, but he's there.
Oh, okay. Can you unmute? Okay. Can you unmute? Let me see.
Maybe he's not hearing his network or he's not hearing.
But
it's online.
Professor Bono? Okay. Does any member of the group want to speak? Dr. Olofa, Shidebere, before we... Okay. Professor Okoye is back. Professor Okoye.
Yes.
Yeah, please. Yeah,
I'm back.
okay. Okay.
Apologies. I wasn't in a place where the network would have permitted me to speak. But I think, you know, the social issue before us is the absolute sellout of our population to all this conspiracy theory. It actually is amazing. Even down to where I work at the teaching hospital, I find it so amazing to find colleagues prancing up and down in the wards, outside the wards, in the clinics, completely without mask. Those of them that will wear them on their neck, and a lot of them would wear them just under their nose. So I said to myself, what hope is there when even the healthcare providers cannot even show that they believe in the situation? Even during the time of vaccination, I was shocked to find that the hesitancy prevailed hugely amongst my colleagues, medical practitioners and healthcare providers. And I just feel like the last speaker commented that there is need to see how we can cause a social behavioral change to the situation. There is this denial that it actually is not prevalent in our country at the moment. Every function you go to, whether it's in a church or whether it's a wedding, whether that is, if you even want to go, you will be so, you know, inundated with people asking you why you're masked. You probably will be like sticking out like a sword with a comb. And right now, the exodus to the eastern part of the country, which usually happens in December, has already started. The traffic on the roads between Lagos and the east cost people 2 days to have access, and the markets are hugely populated, the entire towns are populated, and there is nobody. Absolutely, in fact, the population of people is less than 1/100th of the population of people you see on the streets or anywhere that are wearing masks and wearing it in the right way. So I don't know what we need to do, but we need to engage more with the population. We need to bring the reality of this situation home. Even when you go to a burial of somebody everybody knows that died from COVID, people come there unmasked. So the situation is really huge. The aspect of even other IPC measures, even in our airports, it's so costly. It's as if, oh, let's just, even the person that is trying to tell you to mask is not masked. He has it on his neck. I believe that the social scientists should really go back to the drawing table and see how we can considerably cause behavioral change of the mindset that has already been accumulated and continue to load on due to this conspiracy theory. Thank you.
Very much. If Professor Bono is not back, let me then quickly respond and then summarize our points for today, and then we close. On the issue of international flights, I think we've had the two opinions about it. Talking, I mean, it's not necessary. It's someone say, oh, what we need is to ensure that we take our, own responsibility at home and make sure that we do the right thing. All over the world, international relations requires government and nations working together. The only point I would just want to make is that it was too hasty for any nation to have taken that position against our country, bearing in mind the number of OMICRON in the UK, which is about 150 as at that time, and only 3 in Nigeria. On the basis of equity, I don't think that decision is fair enough on the part of our nation. Then that does not remove the fact that we need to take to take responsibility at home to ensure that we produce our own vaccine and make the vaccines available to everyone, and then also tackle the challenge of acceptance and uptake. I think that is that is core comments that people made on this presentation. I want to remind us that on a final note that during this discussion, we've been able to establish about 8 or 10 agree on 10 points. 8. One is that we try to establish that Christmas and festive period are usually period of joy laced with danger. I think that was the message by Professor Bono, that we should always realize that when we are celebrating, we should be cautious of the danger involved in some of the activities that we are putting together. And that's because that is where the social responsibility comes in. There are guidelines for people to organize large meetings. There are things that they expect to put in place before such a gathering should take place. So if we don't pay attention to the danger involved in our social relationship, the journey may be too long. Secondly, we all agree that Omicron is real, and that the fourth wave, even though it is not very clear now as to the level of severity and the transmission, the rate of transmission, but that what is important is that it is real and it's now with us here. The third day, we all agree that the non-pharmaceutical interventions are still the key intervention strategies that we should continue to emphasize, that people pay attention to, and make sure that they continue to practice. And also said that there's need to break the bridge that connects the general population to the risk population, and that when this is done, it will help to limit the rate of transmission of this disease, and then we enhance the preventive measures and treatment measures that be put in place. We also agree that there's need for individual, household, community, and institutions to take responsibility. And because this is the only way that some of these intervention measures can be practiced, can be can be adopted by and practiced by the individual. We also say that there's no need to politicize the issue, rather that we should emphasize a professional response and that is where the issue of local production of vaccine comes in. That if we're able to produce our vaccines locally, it will be cheaper and it will go round. So that will make it cheaper for the government to control the spread. And also, we say that we need to engage the general population through public education. So, to remove the misgivings about vaccines, and so that people can see the need to take a vaccine. And we also agree that there's need to promote acceptance and uptake of a vaccine, bearing in mind the rate of the misinformation going around about it, and that more education should be provided so that more people will be vaccinated. And by the time the vaccination goes round, and that will fortify the population more adequately. I think I've captured some of the things that we have discussed here today. At this point, I want to thank our host, Professor Okoye. Professor Zuzu, do you want to?
Yes,
Okay.
I just want to add, please.
Okay.
We need to emphasize who is doing the oversight. Who is doing the oversight?
Who is doing the oversight?
Yes, we need to know who is responsible.
Okay. Professor Asusu. Professor Asusu, are you still on? Okay, no. So I want to, at this point, thank everyone that has joined us on this platform. And
where you lost me, but listening to your summarization, I've lost me.
Okay.
Thank you very much.
Thank you, sir. So thank you very much for coming. We normally have this webinar twice in a year, one at the end of the first quarter of the year, and the second one at the around this time, targeting this period. We want to sincerely apologize for starting a little bit late. This meeting is being hosted by the Center for Migration and Globalization of the National Open University. We want to thank the center, the institution, through the center's director, for allowing us to use their platform for this program. We have used this for 3 times consecutively now for this for our webinar. We thank you very much. We also thank the Nigerian COVID-19 Research Consortium, coalition, for giving us the platform to operate on this basis, because our group, Social Science Working Group, is one of the 9 working groups of the NCRC. We also want to thank the NCDC for coordinating the activities and of this consortium. We especially want to show appreciation to Dr. Oshu, who is the director of research in that center and the director of the DG of Dr. Adetifa, for giving us the opportunity to, to carry out this responsibility. So we want to thank you all for coming. We are also looking forward to see you at our next webinar. Thank you very much. And Merry Christmas in advance. Bye. Bye.
Bye.
Thank you very much. Bye-bye.
Thank you.
Thank you.
So I hope we can get the recording, please.
Yes, we do
Right.
that. Professor, Dr. Annette will arrange to send it to me and I'll make it available.
Bye, everyone.
Bye.